I'm Dr. David Hill, and today we're going to talk about how to kill the flu virus. And let's stop here, because the best thing to kill the flu virus is your immune system. Compared to what your immune system can do, I've got very, very ineffective tools with my medications. But the key is your immune system has to recognize the flu virus if it's going to kill it. Now, this is like that movie Predator, where there's that alien and he's shifting shapes. You look at him, you can't see him because he looks like the background. All of a sudden, wham, he's on you. That's what the flu virus does. It changes shape with every flu season. It actually has components, two different proteins specifically, that can be changed around the H and the N, and that's why you hear flus referred to by their H number and their N number, H1N1. And then there are two broad categories, influenza A and influenza B. And this virus is capable of altering its shape from year to year, so that the virus your immune system learned to recognize and fight last year doesn't look enough like this year's virus for your immune system to see it. See, you got the predator thing all over again. So how do we teach your immune system to recognize the flu virus so that it can kill it, which is its job? That's what the vaccine is for. What does a vaccine do? The vaccine shows the shape of that virus to your immune system without letting the virus cause a severe infection. If you get the shot, there's not a whole virus in there at all. The flu shot cannot cause a flu infection. Now, if you get the mist up your nose, which you should not if you have asthma, heart disease, or other severe disease, but if you're healthy enough to get that flu mist up your nose, it does cause a very mild case of the flu, but that also is very effective in teaching your immune system what flu looks like. That way, when the flu comes back this year, your immune system can already recognize it and attack it. Remember, last year's flu vaccine is not good for this year's flu. Now, say you missed out on the flu virus and you got infected with influenza this year, or you actually got the vaccine and you still got infected. The vaccine, I wish it were perfect, but in some years it's not perfect. In fact, the vaccine efficacy rate can be anywhere from 50% to 90% given the year and how well we design the vaccine. So you could still get influenza despite having gotten the vaccine, or perhaps you missed out on getting the vaccine for some reason. We do have medications that help, but the question is, how much do those medications help? Not overwhelmingly. It's not a slam dunk. The most commonly used medication, Tamiflu or oseltamivir, does cut down the severity of illness if it started in the first 2 days for most people, but it doesn't make a huge dramatic difference in a lot of patients. There are other medications that can be used depending on the virus that's prominent during a given flu season. One is zanamivir, another, which is sold as Relenza, and another is amantadine, which has not been effective against a lot of flu viruses in the last several seasons. Rimantadine is another. So you're going to have to watch the bulletins from the Centers for Disease Control to see what drug is working for the flu A or for the flu B in the given season that you catch the flu. Just go to cdc.gov and you should see some sort of flu alert right there. So how to kill the flu virus? Number one, vaccine. Number two, if you get it, talk to your doctor about whether you qualify or need influenza medication and which one would be best. Talking about killing flu, I'm Dr. David Hill.